Hi, my name is Candace, and I am an advanced practice nurse. And I am here to tell all advanced practice nurses and all primary care providers how motivational interviewing has impacted how I care for my patients with chronic diseases or with those patients that have risky lifestyle behaviors. We all know as providers that the rise of chronic diseases are increasing at an alarmingly rate in this nation. In fact, 1 out of every 2 people in this nation have at least one chronic disease. Motivational interviewing, as defined by Dr. William Miller and Dr. Stephen Rolnick, is a collaborative, person-centered form of guiding to elicit and strengthen motivation for change. This is what we need to be looking at when we are working with our patients and changing these risky lifestyle behaviors. Obviously, our traditional methods of giving expert advice or sending our patients to classes or groups to learn behavior changes are not working. Motivational interviewing is a communication skill that advanced practice nurses can easily learn to augment their already interpersonal skills that they use with patients and their families. Families and patients trust nurse practitioners to take care of them. This is just another aspect of how we can do that. As defined by Dr. Miller and Dr. Rolnick, the spirit of MI is what needs to be communicated throughout all of the interactions that you have with your patient. The first part of communicating that spirit is to keep in a collaborative relationship and to be respectful of the patient. The second part of the spirit of motivational interviewing is to elicit change talk so that that patient can actually verbalize and talk about what their change needs to be. And the last is respecting the patient's autonomy for being able to decide whether they want to change or not. This puts that decision of change in the patient's court and takes that responsibility away from the provider. We are in a new era of healthcare where there are new entities such as accountable care organizations being formed. In these ACOs, advanced practice nurses are defined as providers, and we can use our experience and our expertise with communication skills in helping our patients to look at their chronic diseases in a different way, to help them to modify their behavior and to help to decrease the cost to this country and the use of our medical resources. Motivational interviewing is not easy to learn, and it's not a quick fix, but it is something that we can incorporate in our everyday practices, in our everyday visits where we are seeing these patients back over and over again. It can even be done in emergency rooms. It is really up to us, advanced practice nurses, to look at what's going on with our patients in this country with chronic diseases and make an impact and make a statement and try to help these people change their behavior. They want to change. We are not making a difference with traditional educational methods, and these people are dying. What are we going to do? As a profession, we need to do something. And this method, it's been around for years. We need to utilize it. We need to incorporate it into our everyday practice. So I urge you, try to learn motivational interviewing. You can Google, if you will, Motivational Interviewing Network of Trainers. They have a lot of information. There are many books out there and there are many seminars. But please, all advanced practice nurses, make an impact with your patients and learn motivational interviewing to augment your everyday practice and what you are already doing. Thank you.